Feel like you got a rib out of place right here all the time? First thing I can promise you is that you do not have a rib out of place. You likely just have some irritation around that joint due to either the tissue or the joint itself that's causing some sort of inflammation. But honestly, it doesn't really matter because you're just looking for something to help with it. And I'm going to show you 3 things that you can do right now to help. All right, so this first one's posterior rib cage expansion. If your right side's the affected side, you just want your right arm on top. You're going to grab onto something with your arms crossed, pull back, and just let your shoulder blades be pulled away from your thoracic spine, and you're just going to breathe into that upper back area. This next one's a rolling movement where we're getting some pressure into that upper rib area. All you're going to need to do is wrap your arms around your upper thigh. You're going to roll back and then roll yourself forward. You want to think about keeping your spine nice and flexed while you do this. This will just give your spine some tactile cues to kind of release, especially around that rib area. This next one's a rotational drill. You can either use a cable or a band here. It doesn't really matter. What we're trying to do is keep our head forward so that it's just our thoracic spine rotating, and we're getting a lot of protraction and retraction from the scapula, both of which are accomplishing a lot of dynamic movement right around where you're feeling that pain. So here it is again with the band. It's really the same thing. You just want to make sure you have enough tension in the band to pull that shoulder blade off the rib cage. So try these 3 out. Should really help with that spot where you feel like you have a rib out of place or you feel like you have that knot in between your shoulder blades.